Have you ever noticed something strange? You walk into a doctor's office. Maybe your back hurts. Maybe you're tired all the time. Maybe your blood pressure is creeping up, or your cholesterol is off, or you've been waking up at 3 a.m. with a heart that won't stop racing. You describe the problem. The doctor listens, nods, types something into the computer. And then, almost like a script they've memorized, they say the same 5 things. Eat better. Move more. Sleep enough. Drink less. Manage your stress. And you walk out feeling cheated because you came in with a specific problem and you got the same advice your grandmother got, the same advice your neighbor got, the same advice the internet has been screaming at you for 20 years. So you start to wonder, are doctors lazy? Are they hiding something? Is there a secret pill, a real fix, a cutting-edge protocol they're not telling you about because the system doesn't want you to know? Here's what I want to suggest in the next few minutes, and I think it's going to surprise you. Doctors aren't repeating themselves because they're out of ideas. They're repeating themselves because they've seen something most patients never get to see. Something that, once you understand it, completely changes the way you think about your own body. There is a truth they don't explain. But it's not what you think it is. Let me show you. The strange pattern. Imagine you're a doctor for 30 years. In those 30 years, you see roughly 40 patients a day, maybe 200 a week, 10,000 a year, 300,000 human beings in a career, 300,000 stories, 300,000 sets of blood work, 300,000 lives unfolding in front of you, slowly, year by year, decade by decade. Now here's the thing nobody tells you about being a doctor. Patterns start to emerge, patterns that, frankly, would scare you if you saw them all at once. You start to notice that the woman in her 40s who comes in with mild fatigue and slightly elevated blood sugar, if you check back in 15 years, she's often the woman with diabetes, neuropathy, and a heart condition. Not always, but often enough to feel almost like prophecy. You notice that the man in his 30s who drinks just a few every night, who tells you he's fine, just a little stressed, 15 years later, he's the man with liver problems, with depression, with a marriage that fell apart. You notice that the patients who walk 30 minutes a day just walk, nothing fancy, somehow keep showing up, year after year, looking, weirdly, like themselves, while others don't. And slowly something dawns on you. The big dramatic diseases, the heart attacks, the strokes, the cancers, the dementias, they don't usually arrive like lightning bolts. They arrive like glaciers, slow, silent, built up over decades from 1,000 tiny choices. And by the time the patient is sitting in front of you with a specific problem, the glacier has already been moving for 20 years. This is the first piece of the truth doctors don't explain. And it's uncomfortable. Why do equations predict reality, not the universe? Why does the same advice, eat well, move, sleep, don't drink too much, manage stress, work for so many different problems? How can the same 5 behaviors help with depression and heart disease and type 2 diabetes and chronic pain and anxiety and even the risk of certain cancers? It almost sounds suspicious, doesn't it? Like a snake oil salesman with one bottle that cures everything. But there's a reason, and it's the kind of reason you don't really appreciate until you've spent years looking inside the human body. The body isn't a collection of separate machines. We talk about it that way. The cardiovascular system, the digestive system, the nervous system, the immune system. But those are categories we invented to make medical school easier. The body itself doesn't know about those categories. Your gut is in constant conversation with your brain. Your immune system is shaped by what you ate yesterday. Your sleep last night is, right now, deciding how your blood vessels behave today. The hormones from your stress, meeting at 2 p.m., are still bouncing around your bloodstream at midnight, telling your liver what to do. Everything is connected to everything. So when a doctor tells you to sleep better, they're not just telling you to feel less tired. They're telling you to lower your inflammation, regulate your blood sugar, balance your hormones, repair your DNA, consolidate your memories, and protect your heart, because all of that happens quietly while you sleep. When they tell you to move, they're not just talking about weight. Movement is one of the most powerful anti-inflammatory, antidepressant, anti-cancer signals you can send your body. Walking is, biochemically speaking, a form of medicine you cannot synthesize in a lab. When they tell you to manage stress, they're not being soft. Chronic stress hormones, drip-fed into your bloodstream year after year, will damage almost every organ you have. The reason the advice sounds boring is because it works on the layer underneath the disease. It doesn't treat the symptom. It changes the soil the symptom grew in. But here's the catch, and this is where things get interesting. That's not actually the truth they don't explain. That's just the surface of it. The thing they can't say out loud. Let me tell you what really happens in a doctor's mind during a 15-minute appointment. You sit down. The doctor has, on average, somewhere between 7 and 15 minutes to review your chart, ask about your symptoms, examine you, form a hypothesis, order tests, prescribe something if needed, document everything legally, and send you on your way. In those 15 minutes, they are also, whether they admit it or not, doing rapid mental math. They're asking themselves, what does this person actually want? Because, and this is a hard thing to say, many patients don't actually want lifestyle advice. They want a fix, a pill, a procedure, a name for the thing wrong with them so they can go back to living the way they were living. And doctors know this. They've watched it play out again and again for decades. They've watched themselves carefully explain that the patient's chest pain is probably from the 60 pounds of extra weight, the nightly drinking, the sedentary job, the simmering anxiety, and they've watched the patient's eyes glaze over, waiting for the real answer, the prescription, the referral. So over time, many doctors stop giving a long version. They give the short version. Eat better, move more, sleep, drink less, manage stress. It's a kind of compressed code, a summary of everything they wish they could explain in detail if only the patient wanted to hear it, and if only the system gave them more than 15 minutes to say it. Here's the uncomfortable truth. The advice sounds simple because it's been flattened by repetition, but behind each of those 5 sentences there's a small library of knowledge the doctor isn't allowed to read to you out loud, because there's no time, because the insurance code doesn't pay for it, because the next patient is already in the waiting room, because your kid is in the car, and because, and this is the part nobody likes, the doctor knows that even if they did explain it all, most people wouldn't change. Not because people are weak, but because changing your life is hard. What? They akali sikali see. I want you to imagine something. Imagine you could open the bodies of 2 people side by side, same age, same height, same family history. One has spent 30 years in chronic, low-level inflammation, too much processed food, not enough movement, not enough sleep, a baseline of stress that never quite turns off. They look fine on the outside. They might even feel mostly fine. The other has spent 30 years doing those boring 5 things more or less consistently. Not perfectly, not obsessively, just most days. On the inside, you would not believe these were the same species. The arteries of the first person are stiffer, narrower, lined with subtle damage. Their organs are ringed with visceral fat, not the fat you can see, but the kind that wraps around the liver and pancreas, whispering inflammatory signals into the blood. Their cells are showing accelerated signs of aging. Their brain has begun to lose volume in places it shouldn't. The arteries of the second person are softer, more elastic. Their organs are cleaner. Their brain is plumper, better connected. Their cells, biologically, behave like cells of someone 5, 10, sometimes 15 years younger. This is what doctors actually see when they look at the data over a lifetime. Not just one snapshot, but the trajectory, the slope of the line. And the difference between those 2 trajectories almost always comes down to those 5 boring habits, not genetics. Genetics matter, but far less than people think. For most people, genes load the gun, but lifestyle pulls the trigger. Not luck, not a magic supplement, not a miracle pill. The most powerful intervention in modern medicine, and I mean this almost literally, is a person who walks every day, eats mostly real food, sleeps 7 hours, drinks moderately, and isn't drowning in chronic stress. There is no drug that comes close to matching the effect of those 5 things, combined, sustained, over decades. No drug, none. And doctors know this because they've watched it. So when they tell you for the 100th time, you really need to walk more, they're not being dismissive. They're telling you the most powerful thing they know. Why it feels like a betrayal. Now here's the question that always lingers. If this advice is so powerful, why does it feel so underwhelming? Why does walking feel like a joke compared to a prescription? Why does eat more vegetables feel insulting when you came in with real scary symptoms? I think there are 3 reasons, and they're worth being honest about. The first is that we've been trained by an entire culture to associate seriousness with intensity. A serious illness deserves a serious treatment, surgery, medication. A specialist with a long title. When the prescription is go for a walk, it doesn't feel proportional to the fear we're carrying. It feels like the doctor doesn't believe us. The second is that the benefits of these habits are mostly invisible. You don't feel your arteries staying flexible. You don't feel your brain holding on to its volume. You don't feel the heart attack you're not going to have at 63. Prevention is, by its nature, a non-event. And the human mind is terrible at being grateful for non-events. And the third, this is the deepest one, is that this advice puts the responsibility back on us. And that's not always what we want. When the doctor says take this pill, there's a strange comfort in it. Something is being done to you. The pill is the hero. You are the patient. But when the doctor says, walk every day, eat real food, sleep, drink less, breathe, suddenly you are the one who has to do the work. There is no hero outside of you. Just 1,000 small daily decisions, most of them unglamorous, most of them invisible to anyone else, that will quietly determine the shape of the rest of your life. That's a heavy thing to walk out of an office with. No wonder it feels like a letdown. The truth often does. The truth they don't explain. So let me say it now, plainly. The truth doctors don't explain isn't a hidden cure. It isn't a suppressed treatment. It isn't a suppressed treatment. It isn't a conspiracy. The truth they don't explain is that the advice is the cure, that those 5 boring sentences are not a placeholder for real medicine. They are the most powerful medicine we have. The pills, the procedures, the surgeries, those exist to clean up the damage when prevention fails, or when genetics deal someone a hand they couldn't have outplayed. But the foundation, the soil out of which most chronic disease grows or doesn't grow, is built quietly by the way you live on ordinary days. The unphotographed Tuesdays. The Wednesday afternoons no one will ever remember. Doctors don't say this in those words because it sounds, frankly, like a fortune cookie. It sounds too simple to be true. And in a 15-minute appointment with a patient who's afraid and looking for a fix, live well, slowly, for decades, is a hard message to deliver. So they compress it, eat better, move more, sleep, drink less, manage your stress. And when you hear it for the 10th time and roll your eyes, that's the moment to pause. Because it's not that the advice is too small for your problem. It's that the advice is bigger than it sounds, much bigger. Part 7. A different way to hear. And from the way to hear, let me leave you with a way to rehear those 5 sentences, because I think most of us hear them as nagging. They're not. When a doctor says eat better, what they really mean is the food you eat becomes, literally, the cells of your body. You are rebuilding yourself every day out of what's on your plate. Choose materials that don't quietly inflame the thing you're building. When they say move, they mean your body was designed to move, and when it doesn't, every system starts to drift out of tune. Movement is not punishment. It's the signal that tells your body you're still alive and worth maintaining. When they say sleep, they mean every night, while you're unconscious, an enormous repair crew comes through your body and brain. If you don't give them enough hours, the repairs don't get finished, and the unfinished repairs accumulate, year after year, into the diseases of old age. When they say drink less, they mean alcohol is a small, friendly poison. In small doses, your body handles it. In large or constant doses, it quietly damages the very organs you need to live a long life. There's no version of this that goes unnoticed by your body, even if it goes unnoticed by you. And when they say manage your stress, they mean the body cannot tell the difference between a tiger and an unanswered email. If you live as if you are being chased, your body will respond as if it is being chased for years, and eventually it will break. None of this is fortune cookie wisdom. It's the distilled observation of millions of human beings watched carefully across their lifetimes by people whose entire job is to notice what makes us live well and what doesn't. Closing. Reflection. So the next time you walk out of a doctor's office a little disappointed, a little underwhelmed, a little frustrated that they just gave the same advice again. I want you to remember something. They weren't being lazy. They weren't withholding a secret. They were handing you, in the only language a 15-minute appointment allows, the most valuable thing they know. The boring advice is the truth. The repetition isn't a bug. It's the whole message. And maybe the real question isn't why do doctors keep saying the same things? Maybe the real question is the one we don't like to ask ourselves. Why do we keep needing to hear it? Because somewhere, quietly, we already know. We've always known. The body keeps the score, slowly, patiently, for decades. And every ordinary day, the one you're living right now, is being written into it. The good news is that the body is also extraordinarily forgiving. It responds almost immediately to being treated well, not in a week, not in a month, but measurably, surely, at any age. So the secret the doctors don't explain isn't really a secret at all. It's just that the most powerful medicine in the world is also the quietest. It doesn't come in a bottle. It doesn't have a brand. It doesn't make headlines. It only makes lives, and it's been waiting this whole time for you to take it seriously.